too often there for us to pay attention to things that we need to do and need to be familiar with on a daily basis. For example, about a month ago or somewhere near there, there was a tragic accident that happened on the football field wherein this guy took a lick and went into cardiac arrest. Well, because of certain medical procedures and certain medical attention that he got, then they were able, really, I understand that the guy's heart stopped beating. But because of certain processes that the EMTs and the doctors took, then they were able to revive him. I understand he went to the last game, so he's doing well. And so that made people think a lot about the importance of hard health and hard education. And it doesn't, and sometimes, talking about your heart, it ought to be, but it's not very exciting. You know what I'm saying? Because oftentimes it's been called the silent killer as it relates to a heart attack. But it behooves all of us to become familiar with the importance of heart health, to become familiar with preventing heart attack, to become familiar with the things that we as individuals can do in the event that something like that happens. So I thought that, hey, I'll tell you what I'll do. Since everybody's all hyped up about the heart and heart health, I'll call my friend Dr. Obi Emerole, who's a cardiologist here locally, and just have a fireside chat with him about the heart and hard conversation. So how you doing, Doc?
Fine, sir. How are you doing?
I'm outstanding. Thank you so much for joining us. And like I said, you are a cardiologist here in town, and you have been practicing. I remember I seen you walking up and down Second Street and Plum Street for a long time now.
Yes, yes.
Uh,
26 years.
yeah, how long?
26 years.
Wow. So tell us a little bit about yourself.
Um, Obi Emerole is my name. I obtained my medical degree from University of Ibadan in Nigeria. I did internal medicine residency, cardiology fellowship at Downstate in New York, and an additional fellowship in interventional cardiology at Long Island Hospital, Mineola. And I moved to the Middle Georgia area right after training in 1996. Presently, I'm a partner in Georgia Heart Physicians, and I'm the chief of the cardiology division at Atrium Health Navicent.
Outstanding. Chief of the Cardiology Division at Atrium Health Navis. Well, congratulations for that
Yes.
position. And so, let's really talk about because it's so important. And then the bad part about it, I did a show, I guess last week, that was sponsored by the American Heart Association and a group of organizations, that wanted to talk about heart health for February. And they specifically talked about women's heart health because it applies to everybody. But I didn't know that the statistics as it relates to the number of women who are affected by heart health were so staggering, as it relates to the proportion. So, let's talk generally. We're going to start with, what things that one can do, to kind of maintain a healthy heart.
Okay. Yes, sir. Heart disease is the leading cause of death in both men and women in our country. In terms of preventing heart disease, the most effective thing is actually to maintain a healthy lifestyle. Heart healthy lifestyle would include a diet that's rich in whole grains, legumes, avoiding fried food, will include regular aerobic exercise, walking, maybe biking, hiking, jogging, swimming, maintaining a healthy weight, avoiding obesity. It will include avoiding alcohol, tobacco, illicit drugs. It will include managing stress. Building basically support systems to help handle stress. So people who engage in these kinds of preventive behaviors tend to do better. So we consider a heart healthy lifestyle that includes diet, exercise, stress management, avoiding tobacco. Those are the things that can be done to, prevent heart disease. Now, regardless of all of that, we know that some people will still develop, some form of heart disease, or either because of inherited risk factors or other vulnerabilities, environmental factors. So it's also important to, pay attention to the symptoms, be aware of the risk factors. Risk factors will include high blood pressure, diabetes, high cholesterol, family history of premature heart disease, being overweight or obese, and cigarette smoking. So we want to control all these risk factors. And if we notice any symptoms like shortness of breath, chest pain, dizziness, getting fatigued easily, or exercise intolerance, or developing palpitations, fluttering of the heart, swelling of the legs. These are the kinds of signs and symptoms that should make us seek attention early, talk to our primary care provider, maybe request a referral to a cardiologist. So part of management will include early diagnosis and initiation of prompt and effective treatment.
On a regular basis, uh, your family physician uh, tries to check on your heart. Now, how is that? Is that done basically through taking your blood pressure? Because I know uh, a lot of people, when I go to the doctor, they check my blood pressure, blah, blah, blah. So, how important is, monitoring and checking one's blood pressure?
Very, very important. Very, very important. Hypertension is a major cause of heart disease. It's a cause of heart failure. It predisposes to heart attacks. It predisposes to strokes. So if there's one single thing that we should do is to make sure that our blood pressure is under control. Normal is 120/80. Anything above 140/90 is considered hypertensive. And for people with kidney disease or heart disease, we want it below 130/80. Yes. That's one of the things that your primary care provider should focus on controlling. And if it runs in your family, then you want to start checking it early and making sure that it's brought under control.
Okay, I think a lot of people, and you just reminded me that a high blood pressure is connected to hypertension. And I guess a lot of people don't realize that. We worry about a lot of things, and we tend to not pay attention to a lot of things that may be stressing us out. So you are suggesting, I think, do I hear you say that there's a connection between being stressed out and hypertension, which in turn could give us high blood pressure?
Yes, sir. High blood pressure is hypertension, and definitely how we handle stress can affect our blood pressure and can contribute to the risks from hypertension. So it's important, in addition to diet, exercise, weight loss, avoidance of alcohol, tobacco, and illicit drugs. It's important to build systems for stress management. It's important, to have a social support system, maybe a spiritual or religious support system, maybe meditation, maybe prayer, depending on what you believe in. But it's just important to have mechanisms that will help us deal with the stresses that we know will arise in everyday life.
Thank you very much. So, what if one is concerned about, and we all got a family physician, um, but what, after listening to this show, one says, well, I want to really check on my heart. I want to see how I'm doing. So, can they just, because everybody, they're all kind of specialists, and you are a specialist, and you are a cardiologist, which deals with the heart. So, what I'm trying to ask you is, can one, initiate activity as it relates to getting his or her heart checked? Can they call their, if they need a referral, say, well, will you refer me to the Dr. Emerole or any other cardiologist of choice?
Yes,
Because
sir.
I think whole lot more attention has been brought to it. And once you say that, once you answer that, I want to talk about, some other public practices that can be done to help to address the problem with the heart. But can one initiate some kind of activity as it relates to getting his or her heart checked?
Yes, definitely, definitely. I mean, people can self-refer themselves to the cardiologist. A lot of that depends on the insurance provider these days. I mean, some of them will require that you are referred by your primary care physician. Medicare patients can see any provider that they want, and they can call themselves to be checked. In general, if you suspect that you have heart disease because of symptoms, if the patient is getting tired more easily than before, is having chest pain, is having dizzy spells or blackout spells, is having heart fluttering, palpitations, leg swelling, they probably need to be checked out. I mean, what we do will start from getting a good history, just talking to the patient, listening to the symptoms, family history, finding out how long it's been going on, then a physical examination, listen to the heart, listen to the lungs, take the blood pressure. Then we do an EKG, which is a recording of the electrical activity of the heart. It gives us some information. Usually we will do an ultrasound. It's like the ultrasound that women have, but this is an ultrasound of the heart. It shows us how it's pumping, how the muscle of the heart is working, what the valves look like. And then depending on what we find, some people may need more invasive procedures like a heart catheterization, where we pass a small tube under X-ray guidance to take a look at the arteries, see if there is any blockage. Um, and then the treatments will range from medications to some minimally invasive procedures like balloon angioplasty and stents for people who have blockages. And then for people with more severe disease, they may end up needing open heart surgery. And there is also a program for rehabilitation after diagnosis and treatment. And the rehabilitation will include exercise, it will include education on dietary options, it will include education on management of risk factors. So we want people to understand that a lot of people are living long, healthy, and fully productive lives with their heart disease. So it can be managed.
And so it is manageable. Let's talk a little bit about, I know you're familiar with that situation with Damon Hamlin, the guy who died on the football field. And then people began to emphasize the public need for that device, for when people have a heart attack. And for the sake of informing the public, let's say that we are in an environment or a situation where somebody chest start hurting or they have a heart attack or they blank out. I know you call 911,
Yes, sir.
but are there things that citizens can do? Say, for example, in my office, if a person has a heart attack, and then I guess, and you need to tell me how to, I don't know how to use it, but I guess I could learn how to, that whatever
The,
AED, is that what it's
the
called?
AED, AED.
AED, yeah, thank you, Doc. Uh,
Okay.
so what if you find yourself in a situation and no emergency professional is readily available? Because I mean, I didn't think that there were many things that citizens could do, but when I heard them talking about the importance of the availability of AED and how people should learn CPR, talk about the importance of that, how that can be applied regularly in our society.
Yes, yes. Thank you very much for that question. So CPR is cardiopulmonary resuscitation that's initiated when somebody suffers a cardiac arrest. That means essentially the heart stops beating, and you know almost everybody can really learn CPR, and it's important for as many people in the community to know how to do it. These days, we recommend just chest compressions. So the basic thing is to call 911, check for a pulse, and if there is no pulse, initiate compressions. If the AED is available, it's a device that you put on the chest. It's automated. It tries to detect the rhythm of the heart, and if it's a rhythm that can be treated by electric shock, it will shock the rhythm back into normal. So it doesn't really need for the person to do so much except to turn it on. Um, but of course, like every device, you have to be a little familiar with it. So a cardiac arrest, which is a situation in which the heart is not pumping, is different from a heart attack. So a heart attack really occurs when there's a sudden blockage in one of the arteries in the heart, and it leads to chest pain, shortness of breath, sweating, and some of the other symptoms. But majority of the people who are having a heart attack will still have a pulse and will still be able to talk. They will still have a blood pressure, so they are not having a cardiac arrest. And in that situation, you just need to call 911 to take them to the nearest emergency room. They don't need CPR, they don't need defibrillation. Now, a heart attack can lead to a cardiac arrest, but not always, actually not often. Now, people can also have a cardiac arrest without having a heart attack. So there are other things, heart rhythm problems, weak heart muscle, in the situation of, the unfortunate situation of the young man, just badly timed hit to the chest wall during a vulnerable time in the cardiac cycle. So yes, it's very important to teach CPR to as many people as possible in the community. It's important to have these AEDs probably at every game, in every school, in all public places. And it's very important to have a functional emergency response system. And, the young man is alive today just because all of those things were available to him.
Well, that is so outstanding, and we are so glad he is that he is alive and that they were able to recover him. And we're also very happy that seemed to bring some attention to the importance of heart health and healthy living and the difference between a heart attack and cardiac arrest. And those kinds of things. So that is very, 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 very important. Now, are there any? I'm sure that one can go to the Atrium website. You know, Atrium is very, very involved in community health and just keeping the community educated and informed, not only as it relates to the heart, but as it relates to healthy living. So I'm sure that we will post the website, you know, on the screen so people can go to it. So let's just kind of wrap it up and then just give another few words of encouragement as it relates to letting people know the importance of heart health and go ahead and remind us about what healthy living is and what to do in the event that we feel sick or having some symptoms of heart trouble.
Thank you very much. Yes, I will say that heart healthy lifestyle is a lifestyle that includes diet, a good diet, mostly plant-based, whole grains, legumes, exercise, regular aerobic exercise, walking, biking, hiking, swimming. It includes maintaining a healthy weight, avoiding obesity. It includes avoiding tobacco, definitely, avoiding excessive alcohol, avoiding illicit drugs. It includes learning how to handle stress. It includes, monitoring for risk factors and controlling them. And the risk factors include hypertension, diabetes, high cholesterol, cigarette smoking, family history, and being overweight. It also includes paying attention to your body, seeking care when you develop symptoms early. And the symptoms include chest discomfort, shortness of breath, dizziness or blackout spells, palpitations, and leg swelling. And anybody developing those should see their primary care provider, maybe have a discussion about being referred to a cardiologist. Basically, heart disease is treatable, and most of our patients go on to live long, healthy, productive lives with their family members and great support and with the great support and help from their community.
Well, that's outstanding and that's encouraging. So what I'm hearing you say is that if in fact, even though that you may have those problems and you may have been engaged in those behaviors, if you can go and see your family care physician, and you know if you pay attention to those things, and this is Heart Health Month, and our reason for having Dr. Emerole is because we wanted to try to impart information to the community as it relates to heart health. And he has done a phenomenal and informative job and educative, if I could use that word, job, job of informing us on some of the actions and the symptoms and the behaviors that one would take in trying to have a healthy heart and to live a long life. I have been interviewing Dr. Obi Emerole. And what's that position again, Doc? And congratulations on it. What's your position at Atrium?
Oh, I'm the chairman of the cardiology division, and I'm a partner in Georgia Heart Physicians here in Macon.
Okay, he's the chairman of the cardiology division at Atrium, but he's also in private practice and with Georgia Heart Physicians. So, you know, and then did I hear you say, Doc, that if you've got insurance, that it's possible to go directly to a cardiologist without a referral, although some insurances require referrals?
Some require referral. Some you can go directly. With Medicare, you can also go directly. So I think, you may want to check with your primary care provider, but yes, most people are able to go directly to a cardiologist.
Okay. Well, I want to congratulate you and thank you. That information is very, very informative. And I hope that I'm not the only one who's motivated to go see my cardiologist, because it's important as it relates to healthy living and a healthy life. This is a call to action. I'm your host, Alex Habersham, trying to emphasize that this is February is heart month, but our heart pumps 12 months a year. So we need to be concerned about actions that we can take to have a healthy heart and live a long life. Thank you so much, Dr. Emmanuel. Keep up the good work and call us if you need us.
Thank you very much, sir. Really, thank you for having me. I appreciate it.
Yes, sir.
Thank you.
This is a call to action. I'm your host, Alex Habersham. And remember, you can join our YouTube channel, Alex Habersham YouTube. So, and everybody needs to know this, and you can help people know it by joining our channel and letting people know that a call to action is designed to inform, educate, and improve the community. Have a great day.
www.makingblackpages.com.
Think Black Pages first.
You better think
Black Pages.
When purchasing goods like beauty supplies, cell phones, clothing, and food, think Black Pages first. For services like cleaning, event planning, and healthcare. Search, shop, support.
The Macon, Middle Georgia Black Pages.
Community for attorneys, auto, barbers, books, catering, churches, DJs, insurance, venues, and more.
Over 1,600 African-American businesses listed.
Serving Baldwin, Bibb, Crawford, Houston, Jones, Monroe, Peach, Twiggs,
Damn.
Wilkinson counties. When you spend money in your community, you are supporting the advancement of your community.
Our motto is
Have you hugged a black business today? Well, here's your chance with the new
the new
2022-2023 edition.
of the Macon, Middle Georgia Black Pages.
So think Black Pages first. Available in hard copy and
Digital.
get your copy today. Think Black Pages first.